Okay, so hello everybody. My name is Emily and these are my teammates Talene and Drew, and we are here to present a formative evaluation of Professor Wellbody's Academy of Health and Wellness. And a little background information on the exhibit. It's the first new permanent exhibit in over 10 years and it opened recently in December of 2012. And this area is a 7,000 square foot space that introduces healthy well-being as a lifelong process that can be achieved through exercise, diet, proper rest, and hygiene. And it's broken up into these 7 themed areas, the Cafe Diem, Gymnasium, the Loft, Palladium, Slumbertorium, the Studio, and Wellbody Hall. And I think the names are kind of self-explanatory. And the purpose statement of our evaluation is to gauge if and how visitor engagement is translating into awareness of health and wellness practice. And this evaluation will be used by the Pacific Science Center for a more comprehensive review of the exhibit at a future date. And these are our 3 evaluation questions. The first is, where do visitors currently find information on health and wellness? The second is, where in the Wellbody Academy are visitors spending the most amount of time and why? And the third is, what messages are visitors taking away from their visit to the Wellbody Academy? Essentially, to what extent are visitors able to recall facts or information pertaining to wellness choices?
Thank you, Emily. So I'm going to talk to you a little bit about the methods that we used in creating our study and then in using our instruments. And after meeting with the Pacific Science Center and looking at the evaluation questions, it became apparent to us that we would need to use 2 instruments. One would be a web-based survey, and it would include 1 quick question just saying, where do you get your general health and wellness information? And they had 19 options of which they could choose as many as applied. And then there was also some demographic information regarding gender and the year that they were born. Our second instrument, Instrument B, was an on-site administered survey which asked people where they perceived spending the bulk of their time in the exhibition, how much time they felt they spent there, why they chose to spend their time in that location, and then we also asked them what impression they got of the overall Wellbody Academy, what was the overall message that we were trying to communicate, and we asked them if they were able to recall any facts that they wanted to share with us. And the way that our instruments worked is we did 2 email blasts with the web survey, and it was also posted to the Pacific Science Center's Facebook page and Twitter feed. We garnered a total of 174 responses using the SurveyMonkey website. However, we only had access to the first 100 of those responses because we were using the free version of SurveyMonkey. We also were unfortunately not able to do some cross-analysis regarding gender and responses for the SurveyMonkey, the web-based survey. However, for the on-site administered survey, we went the old-fashioned route and had paper and pencils. The 3 of us went to the Pacific Science Center on Saturdays and Sundays for about 3 hours at each time to gather information from just the general visitor base that would be there on a weekend. We had family groups, we had adult groups, we had solo visitors, and it was on the morning and in the afternoon on a Saturday and a Sunday, and we gathered a total of 100 and just over 110 responses, 109 which we considered to be valid and used for our analysis. We're really pleased with that because we have the 100 web surveys as well as the 109 on-site, so we felt that was pretty comparable in information. Some of the limitations that we did face were the fact that the SurveyMonkey limits you in your capabilities when you use the free version. Additionally, for the web-based survey, it's all self-selecting, so you had to have a vested interest in responding to that. We did only do our on-site surveys on the weekends, so we do know that we limited ourselves to an extent. However, that afforded us the opportunity to avoid school groups in the galleries and any implications or detractions that they might provide on individuals trying to enjoy the exhibition space. And here's just a further breakdown on our population. For the web survey, we had 63 females respond, and we had respondents crossing 4 major generations, but the predominant responses were coming from boomers and Gen X. And then for the on-site survey, it was almost a 50-50 split between males and females. we had a better representation of boomers, Generation X, as well as millennials, pretty prevalent there. And then to share with you our findings, our first evaluation question, again, from that web-based survey, was asking where people get the bulk of their health and wellness information. Of the 19 different categories, people picked on average about 4.43 different options. These were the top 4 options that people selected, and together made up 60% of the total 443 selections chosen. You can see that the first 2 are very medical specific, either from a medical professional or a medical website, and then the next 2 are pretty informal means of gathering health and wellness information. And then here's a chart that just shows you some of the other options that people had, such as TV shows, medical journals, and newspapers.
So the next evaluation question that we covered was, where are visitors spending the most amount of time and why? And this was covered as the first question on our exit interview, which was pretty much, how long do you think you've spent at the Wellbody Academy today? And the answer choices were in increments of 15 minutes, and visitors were asked to specify which time frame they believe pertained to them. So as you can see from the numbers up there, a majority of people stayed within the first 30-minute time range. So 54 respondents stayed 0 to 15 minutes, and 47 respondents stayed 16 to 30 minutes. After this, visitors were asked to identify the area that they spent the most amount of their time in, and the 2 highest response areas were the Palladium at 32 responses and the Cafe Diem at 30. Once the visitor chose an area, we asked them to explain what they enjoyed the most about that particular space, and 12 codes were created for the various responses given. And as you can see, 25% of respondents stated interactivity as the reason for their enjoyment, and this is the most common reason given. Another 18% of respondents mentioned their children in their answers, which was the second most common reason given, either as deriving enjoyment through or with their children. And you can see that from the quotes. She is the one who loves it and playing with her is fun, versus the kids are more occupied. And I'd like to apologize for the reasons for visitor enjoyment labels. We chose them based on what visitors were describing them as. So. And to break down the analysis a little bit further in the numbers, here are the top 4 areas that visitors stated in order of popularity from highest to lowest, and the Palladium was the highest. Most respondents who stated this area stayed for 16 to 30 minutes, and of these, 11 visitors further stated their kids as a reason for enjoyment. The Cafe Diem was the second most popular area. Respondents typically stayed 16 to 30 minutes, and most who stated this area also highlighted the meal planning option as the reason for their enjoyment. And the next option that was the most popular was that their time was spent equally in all areas. However, most of these individuals only spent about 0 to 15 minutes in this time range, typically less than 5 minutes. And these were individuals who usually just kind of breezed through the exhibit. Some even stated, quote unquote, nothing as their reason for enjoyment. And the least amount of mentions were from the Wellbody Hall, which only had 1 respondent state this area. And this is likely an outlier because this respondent also stayed 46 to 50 minutes, which is a much higher number of minutes than the average.
Thanks, Emily. All right, so for our third evaluation question, we wanted to look at what messages people were taking away from their visit. So each response that was given, we gave up to 2 codes, and a majority of the respondents said that they believe the message to be about general health awareness, and secondly, about be educational in nature. That also showed a trend in an area-specific message. And what we mean by that is people that said an exercise message, that was associated to the Palladium, and nutritional message was associated to the Cafe Diem. And of those people, 53% of them had also said that they spent the bulk of their time in that area that they related the message to. So the second part of our third evaluation question, we also wanted to look at what facts people were taking away from the visit. 40% of our visitors said that they didn't learn any facts. But of those 60% who did, we first noticed a trend. There were 3 major ways that people recalled their fact. The first was a general, which meant for example, people would say, most people don't get enough sleep. Or they would internalize it saying, I don't get enough sleep. Or they would relate it to a family member and say, my kids don't get enough sleep, or my husband doesn't get enough sleep. And there was also a trend in an area-specific facts. As you noticed, the cafedium had the highest percentage of facts that were related to it. And at the same time, it was the second highest time spent. But in other words, the palladium only had 2% of facts recalled from that area, and 29% of the people said that they spent the bulk of their time there, so there was a gap there. But at the same time, where 10% of the gymnasium people spent the bulk of their time, 32% of facts that were recalled were from the gymnasium, as well as an increase in the slumbertorium. So overall, a majority of respondents received health and wellness information from their primary care provider and specific medical websites. They also stated that they spent a bulk of their time in palladium and cafedium, and we believe a majority of the sample believes the message to be about general health awareness and be educational in nature. And 60% of the visitors were also able to recall facts. And as part of our partnership with the Pacific Science Center, we also wanted to include possible research questions where they could take this evaluation. And some of the research questions we came up with were, why do visitors spend a bulk of their time in certain areas? Why do visitors recall facts in certain areas but not others? And why do adults feel that the Wellbody Academy is not suitable for their age group? So we'd also like to take this time to thank Angie, Chris, Nick, and the Pacific Science Center for all their time and help. And we'd now open the floor to any questions.